Hi, it's Dr. Herman here. This is a patient of mine whose name is Marvin Lembark, or also is known as Marty. Uh, Marty had, well, there's various symptoms and various diagnoses that Marty was suffering from, but he originally came in here for peripheral neuropathy. And part of that problem, as you'll get to know me through this website, is with diabetes as well, and also congestive heart failure with his case. But his peripheral neuropathy was so bad that he had extreme difficulty in walking. Now, Marty and I met. He came to me for a consultation and examination a little over a year ago. This right now is January of 2011. So a little over a year ago or so, right? He came to me for a first consultation and examination, and after I told him what I felt I could do with him and for his condition, I mean, certain things are not covered by Medicare here, and that was, that was something that's hard for some people to understand, and I understand that as well. But Marty still felt that medicine was the answer for him, even though he was still suffering. So Marty, if we could, we'll just tell some people out there of what was going on with you. You've been a diabetic for how long do you know you've been diabetic?
4 years.
4 years is what you know, is when they first diagnosed you and put you on medicine.
That's right.
Metformin was the medication? Glipizide.
Glipizide.
Glipizide is the medicine. And you've also been on high blood pressure medication.
Bumatide.
Bumatide. How long have you been on Bumatide?
As long as I can remember.
As long, 20, 30, 40 years?
15 years.
15 years, okay. And were you on cholesterol meds?
Yes.
Cholesterol meds. And you've actually got a list of meds that
I have a list of meds.
A list of meds that he was on. Now the story is different, but we'll get there in a moment. Marty, when you came here, when you came back for your second visit with me, which was a few months after the first visit, what happened to you in the process?
In between those visits, I had congestive heart failure.
Congestive heart failure.
And they put me in the hospital and tried to do a stent for circulation and so forth.
A stent in the heart or a stent in the leg?
A stent in the leg, and they also had put a catheter in me, and they were pumping water out.
That's right. You had the
big belly.
His abdomen was so distended with fluids that he was not able to empty the fluids, and it was pericardial effusion that was going on. He had fluid retention around the abdomen and the chest, and it was very difficult for you to breathe.
Oh yes, I'm a golfer and I couldn't even play anymore. I couldn't walk up to the green.
When he came in here, when I met him the second time, we'll get back to his story in a minute, but when he came in for the second visit, or the second consultation with me, after he realized that medicine, we'll get to, was not going to help him at this point in his life, he walked in and literally the legs were in so much pain from the peripheral neuropathy, and he had so much. He told me that he was not really eating much, right? You were eating maybe twice a day.
I had no appetite.
No appetite, and the belly was getting bigger and bigger, fluid retention, and they told you that the only option was maybe pumping fluids, right? Which was the catheter.
That's right.
Okay, so back at the first medical hospital, they cut open his legs to try to put stents in the arteries to help blood flow. They figured that was the reason his blood pressure was low and wasn't getting blood to the peripheral nerves, and that's why the legs and feet were in so much pain and numb. And that they couldn't do it because of the risk of age.
No, they said my veins were too mushy.
Too mushy. Okay.
And the stent wouldn't take.
What else did they do for you in the first hospital?
Which one?
The first place you went, you said was Florida.
No,
We don't want to name them. We don't have to name the name, but one of the Florida hospitals here. You had a problem.
Right.
And they decided stents no, catheter forget it, goodbye.
No, catheter, drain the water.
Drain the water.
And that's goodbye.
That was it.
That's it.
Did they give you any outlook on what your life was going to be like?
No, the only thing I can tell you was after I got out and I visited a cardiologist, he said, I don't believe it's the same person. I thought we gave you 10 days to live in the hospital.
That's now. But let's go back to the middle story before we tell the good news,
okay.
Which you can see you smiling right now. But we'll get to the good news in a minute. After the first hospital here in Florida, you went to a second hospital for, you told me, about a period of 2 months of in and out testing and visits with various physicians.
Oh, that was a different,
Different
hospital.
hospital.
Different
Okay.
hospital.
And they did, because they said your leg pain might be from the back, so you had some CAT scan done. They also tried to offer you, and they couldn't find a problem in the back causing the leg problems, right?
Right.
Then they wanted to do stints,
Yes.
and they,
Surgeon that they had at the facility said it's too dangerous.
too dangerous.
Yes.
And what other, I mean, were they doing heart tests, were they doing brain tests, what else did they offer you?
Complete physical from
From head to toe?
head to toe.
Everything, in and out, up and down, they did all these
Right.
tests on him over 2 months, and very expensive tests, and they can collect on his Medicare, and great, but at the end of those 2 months, did they give you any positive outlook on life?
No.
Were you
None at
feeling
all.
any better?
None at all. No.
Were there any other medications that they offered you? We don't have to name names of other meds, but did they give you
No.
other meds and said, here's hope for you?
No.
What was their projected outlook for you?
Stay the course you're on. There's nothing more we could do, and just watch yourself.
Watch yourself. And possibly come back periodically for more draining of fluids.
No, they didn't even mention that.
Can you imagine?
They didn't mention that.
Now, your wife, or should I say your significant other,
Yes.
had told me in the consultation with you that they offered you maybe how long to live at that point in your life
When I was in the hospital,
when you're in the hospital.
they didn't expect me to live 10 days.
They offered you 10 days of life is what they told. That's what they told her. They didn't scare you with that
No.
information. But they still let you go. When Marty came back here into the office for the second consultation, this wasn't really for a consultation. This was a man who was not as you see right now. And I wish I could have videotaped him coming in for the second appointment with me, because he wouldn't let me. He was wasn't feeling too good and kind of embarrassed in his physical presentation. So I refrained from doing a mandatory pre-video to the care that I was about to offer him. But Marty was in such bad shape that even walking from the front desk back here to my office room to talk with me, he was out of breath. He had to stop on the way to this office, which is literally maybe 50 feet. He had so much pain in his legs, he was walking, waddling like a Frankenstein. The legs were that painful, right? He had about 30 extra pounds of fluid retention around his belly,
Right.
right? He was